Hi, my name is Elizabeth Rich, and I'm the therapy manager here at Methodist Rehab in Ridgeland. I'm a physical therapist, and I also specialize in the Strauss scoliosis method for treating scoliosis patients. I've been a physical therapist for almost 20 years, all here at Methodist Rehab. My husband Mark and I live here in Ridgeland, and we have 3 children. Ellis, who's going to be a senior, Maggie, who's going to be a junior, and Charlie, who will be in 5th grade. There's several exciting programs that we have here at the Ridgeland Clinic. One of those is our QUEST program. The QUEST program is a community integration program, primarily for patients with neurological injuries, but also amputees and some other diagnoses. But what it is, it's helping those patients get back to what they were doing prior to their injuries. So whether that's a job or school or some type of active community involvement, jobs are tailored so that they can get back to doing something meaningful and get back involved in the community and hopefully get back to work as well. Another thing that we have here is a in-ground pool. Pool offers an underwater treadmill and a current generator. So the patient is able to walk with decreased gravity. They're also able to use the resistance from the current generator to work on strengthening and building their endurance without gravity. And so it's able to help a lot of patients, whether it's severe arthritis or just getting back to increasing their mobility without the full effects of gravity. Some other treatment programs that we offer are Strauss scoliosis therapy, and that's something that my coworker Rachel and I perform. And what we are doing is working with patients with scoliosis and trying to help them obtain and maintain a corrected posture and working on strengthening them in that corrected posture. It can be for patients of all ages, from teenagers to older adults, and we want them to have the maximal posture and be able to do what they want to do, and we don't want their scoliosis to limit their overall functional mobility. And so we use the bars here and use a lot of muscle memory work to help them to obtain that corrected position and so that posture becomes their new normal. Another thing we offer is pelvic floor therapy. And Sylvia McCandless is our pelvic floor therapist here. Sylvia works with our patients, both male and female, on a variety of disorders, and she's really helped them be able to increase their quality of life where those pelvic floor dysfunctions don't inhibit them from doing what they want to do. Another really cool piece of equipment that we have here is our AlterG treadmill. And so the AlterG treadmill is kind of like being in the water, except you're not in the water. So you're able to get back to walking or running with decreased weight bearing. And we also have a special sensor where you're able to visually see how much weight you're putting on each foot so that you can try to equalize your step length and your weight bearing. So whether it's an injury you've had on one lower extremity or a stroke, you're able to really work on fine-tuning your gait while you don't have full weight on you so that you can do a lot more sooner to speed up your rehab process. So at this clinic, we offer physical therapy, occupational, and speech therapy services. Specifically, some of those things that we provide would be manual therapy, neurological therapy, orthopedic therapy, lymphedema therapy, dry needling. We also provide the special program for Parkinson's patients called LSBT, or Big and Loud, which is both speech, physical therapy, and occupational therapy focused. And then we have a Big for Life group that is a community-based program that meets when a patient has completed the LSBT training. We would love to be able to meet you and help you with your needs. To make an appointment, you will need a referral from your provider, nurse practitioner, physician assistant, or physician. They can fax that order to us, or you can bring it to us, or give our office a call, and we would be glad to get you set up and get you started with therapy.